Good afternoon. My name is John O'Brien. I will be talking to you for a few minutes about chronic obstructive pulmonary disease, or COPD. This is a picture of the lungs, and once again you will see the major air pipe dividing to the right and left bronchus and progressively dividing airways until one gets to the air sacs or alveoli where the gas exchange takes place. COPD is a condition that involves both the air pipes and the gas exchanging component of the lung, or the alveoli. There are a number of conditions that fall within the umbrella of COPD. The two most important are these two, chronic bronchitis and emphysema. Sometimes linked with them are chronic asthma and bronchiectasis, though this is somewhat controversial. Chronic bronchitis is a clinical definition. It is based on the presence of cough and sputum for more than 3 months a year for 2 consecutive years. There is also a pathological definition relating to the number of mucus glands in the airway. What happens in chronic bronchitis is chronic irritation of the airways causes swelling of the lining of the airway and increased mucus glands and increased mucus production, and the inflammation causes thickening of the lining of the airway with consequent narrowing. Scarring also causes loss of elasticity and compliance of the lung. Emphysema, on the other hand, is destruction of the most distal part of the airways, distal to the respiratory bronchioles, where the alveoli get damaged and destroyed and lose their elasticity and become enlarged and cyst-like. If you look at the chest radiograph of a patient with emphysema, you will see these very large lungs with flat diaphragms compared to the more normal chest radiograph on the right. If you look at this list of causes of COPD, you will see top of the list is cigarette smoking, and you can for practical purposes forget the rest, although in developing countries the inhalation of biomass fuels and tuberculosis and occupational dust exposure can certainly be important. But in the first world, cigarette smoking is the most important cause. COPD is the largest contributor to the burden of disease associated with lung disease. It's escalating. In 1996, the Global Burden of Disease study compared the leading causes of disability in 1990 and 2020. This was a projected study, and it is projected to rank 5th in 2020 behind ischemic heart disease, major depression as a leading cause of disability. We will be scooting up. These are frightening statistics relating to the severity of the impact of COPD on world health. It is the 5th most important economic disease in the world, costing something like $20 billion a year to treat in the United States. The male death rate has been declining, while the female death rate is increasing. The prevalence of cigarette smoking in South Africa is quite varied because of different population groups and socio-economic factors. Worldwide, the baseline prevalence of smoking at present is around 20%. This sort of advertising in years gone by was responsible for people starting smoking, and it is only in recent years that the more modern type of advertising has also been banned, suggesting that a good way to keep your weight down is to smoke. Now, deaths from tobacco relate not only to COPD, but they relate to a number of other conditions including heart disease, cancers, and chronic bronchitis and emphysema accounts for about 20% of smoking-related deaths. It was first brought to the attention of the public by the US Surgeon General's report in 1964. About 20% of smokers will develop COPD, and as mentioned, they will also have high cardiovascular risks. For example, there's a myth that breast cancer is the leading cause of cancer death among women in the United States. And the fact is that lung cancer became the leading cause of cancer death and has been so for many years. There are two major presentations of COPD. The one is the so-called blue bloater, who tends to have low oxygen, elevated carbon dioxide and polycythemia, and the other is the pink puffer, the more emphysematous patient, who tends to lose weight and remain pink and oxygenated at the cost of a high work of breathing. If one looks at loss of lung function in patients who are susceptible to COPD, you will see that with time we all lose lung function due to aging. If you are one of those 20 to 30% of COPD patients who is going to lose lung function more rapidly, the lung function decline will progress inevitably unless you stop smoking, at which point you do not get back the lung function you lost, but the rate of decline will parallel what it would have been. The only intervention that will stop the rapid decline of lung function in smokers is to stop smoking. So what happens? The airways become inflamed, various inflammatory mediators are released, causing destruction of the airway walls and the alveoli. And there are three terms used. COPD is chronic obstructive pulmonary disease, chronic obstructive airways disease, and chronic obstructive lung disease. The topical one today is COPD. This is a typical manifestation of someone with emphysema, and there is a overlap between the different manifestations of airway disease, and this non-proportional Venn diagram shows the interrelationships between conditions like asthma, emphysema and chronic bronchitis. The most important treatment is to stop smoking, and various bronchodilators can be helpful. Assessment of severity most recently uses the BODE index, which looks at body mass index, obstruction, breathlessness and exercise. With assessment of these patients, one must remember there's poor correlation between X-ray findings and lung function is the gold standard for assessing severity. Chest X-ray report of emphysema should not be used in evaluating the severity of COPD. Clinical findings also have poor correlation, and one must rely on lung function. Once the lung function drops significantly, there is increased mortality, and the FEV1 is very low. These patients are uninsurable. Patients with predictable mortality will have very low lung function, have low oxygen levels, and obviously have cardiovascular distress, and this will manifest with strain on the right side of the heart.